Human behavior and victimology.
What is behavior?
Behavior refers to the actions and mannerisms made by individuals, organisms, systems, or artificial entities in conjunction with themselves or their environment, which include the other systems or organisms around as well as the physical environment. It is the computed response of the system or organism to various stimuli or inputs, whether internal or external, conscious or subconscious, overt or covert, and voluntary or involuntary. What is abnormal behavior? Abnormality or dysfunctional behavior is a behavioral characteristic assigned to those with conditions regarded as rare or dysfunctional. Behavior is considered abnormal when it is atypical or out of the ordinary, consists of undesirable behavior, and results in impairment in the individual's functioning. Abnormality is that which is considered deviant for specific societal, cultural, and ethical expectations. These expectations are broadly dependent on age, gender, traditional, and societal categorization. The definition of abnormal behavior is an often debated issue in abnormal psychology because of this subjective variable. What is psychopathology? Psychopathology is the study of abnormal cognitions, behavior, and experiences. It can be broadly separated into descriptive and explanatory. Symptoms of abnormal behavior. First, long period of discomfort. This should be anything as simple as worrying about calculus tests or grieving the death of a loved one. This distress, however, is related to the real, related, or threatened event and passes with time. When such distressing feeling, however, persists of an extended period of time and seem to be related to events surrounding the person, they would be considered abnormal and could suggest psychological disorders. Second, impaired functioning. Distinction between simply a passing period of inefficiency and prolonged inefficiency, which seem explainable. For instance, a very brilliant person constantly fails in his classes, or someone who constantly changes his job for no apparent reason. Third, bizarre behavior. This has no rational basis, seem to indicate that the individual is confused. The psychosis frequently results to hallucination, basely sensory perceptions, or delusion beliefs which are patently false yet held to be true by the individual. Fourth, disruptive behavior. It means impulsive, apparently uncontrollable behavior that disrupts the lives of others or deprives them and their human rights on a regular basis. What is mental disorder? Mental disorder, also called a mental illness or psychotic disorder, is a behavioral or mental pattern that causes significant distress or impairment of personal functioning, such as features may be persistent, relapsing, and remitting, or occur as a single episode. Many disorders have been described with sign and a symptom that vary widely between specific disorders. Such disorders may be by a mental health professional. The cause of mental disorder are often unclearly. Types of mental disorder. First, psychosis is an abnormal condition of the mind that results in difficulties determining what is real and what is not real. Symptoms may include delusion and hallucinations. Other symptoms may include incoherent speech and behavior that is inappropriate for the situation. There may also be sleep problem, social withdrawal, lack of motivation, and difficulties carrying out daily activities. Psychosis in adolescents is a serious medical illness, but it's not very common. Second, organic brain syndrome, also known as organic brain disease, organic brain disorder, Organic mental syndrome or organic mental disorder refers to any syndrome or disorder of mental function whose cause is alleged to be known as organic or sociologic rather than purely of the mind. These names are older and nearly obsolete general term for psychiatry, referring to many physical disorders that cause impaired mental function. Third, substance-related disorder is the persistent use of drugs, including alcohol, despite substantial harm and adverse consequences. Substance use disorders are characterized by an arise or mental, emotional, physical, and behavioral problems such as chronic guilt, an inability to reduce or stop consuming the substances despite repeated attempts, driving while intoxicated, and psychological withdrawal symptoms. These are the examples of substantial related disorder. Fourth, anxiety disorder. Anxiety or fear that interferes with normal functioning may be classified as an anxiety disorder. Commonly recognized categories include specific phobias, generalized anxiety disorder, social anxiety disorders, panic disorder, agoraphobia, obsessive-compulsive disorder, and post-traumatic stress disorder. Mood disorder. Other affective mood disorder. Other affective emotion mood processes can also become disordered. Mood disorder involving unusual, intense, and sustained sadness, melancholia, or despair is known as major depression, also known as unipolar or clinical depression. Milder but prolonged depression can be diagnosed as dysthymia. Bipolar disorder, also known as manic depression, involves abnormally high or pressured mood states, known as mania or hypomania, alternating with normal or depressed mood. The extent to which unipolar and bipolar mood phenomena represent distinct categories or disorder or mix and merge along a dimension or spectrum of mood is subject to some scientific debate. 6. Somatoform disorders may be diagnosed when there are problems that appear to originate in the body that are thought to be a manifestation of a mental disorder. This includes somatization disorder and conversion disorder. There are also disorders of how a person perceives their body, such as body dysmorphic disorder. Neurasthenia is an old diagnosis involving somatic complaints as well as fatigue and low spirit depression, which is officially recognized by the ICD-10 International Classification of the Disease, but no longer but the DSM for Diagnostic and Statistical Manual of Mental Disorder. 7. Dissociative disorder or DD are a condition that involves disruption or breakdowns of memory, awareness, identity, or perceptions. People with dissociative disorder use dissociation as a defense mechanism, pathological and involuntarily. Some dissociative disorder are triggered by psychological trauma, but the personalization, the realization disorder may be perceived only by stress, psychoactive substance, or no identifiable trigger at all. 8. Personality disorder. Personality, the fundamental characteristic of a person that influence thoughts and behavior across situation and time, may be considered disorder if judged to be abnormally rigid and maladaptive. Although treated separately by some, the commonly used categorical schemes include them a mental disorder, albeit on a separate axis too. In the case of the DSM-4, a number of different personality disorders are listed, including those sometimes classed as eccentric, such as paranoid, schizoid, and schizotypal personality disorder type that have described as dramatic or emotional, such as antisocial, borderline, histrionic, or narcissistic personality disorder, and those sometimes classed as fear-related, such as anxious, avoidant, dependent, or obsessive-compulsive personality disorder. The personality disorders in general are defined as emerging in childhood or at least by adolescence or early adulthood. 9. Sexual disorder and gender dysphoria. This disorder includes dyspareunia and various kinds of paraphilia, sexual arousal to objects, situation, or individuals that are considered abnormal or harmful to the person or others. Gender dysphoria is the distress a person feels due to the mismatch between their gender identity and their sex assigned at birth. People with gender dysphoria are typically transgender. The diagnostic label gender identity disorder was used until 2013 with the release of DSM-5. The condition was renamed to remove the stigma associated with that term disorder. 10. Neurosis is a class of functional mental disorder involving chronic distress, but neither delusion or hallucination, to refers to disorders of sense and motion caused by a general affection of the nervous system. Cullen used the term to describe various nervous disorders and symptoms that could not be explained. Psychological, physical features, however, were almost inevitably present in physical diagnostic tests such as exaggerated knee-jerk, loss, the gag reflex, and dermatographia were used into the 20th century. The meaning of the term was redefined by Carl Jung and Sigmund Freud over the early and middle 20th century and has continued to be used in psychology and philosophy.